Welcome to the Med Spa Method. My name is Leslie Schweitzer, and I'm a doctorate-prepared nurse anesthetist and the owner of Real Aesthetics and Wellness. This show is your guide to navigating the med spa world with confidence. I'm going to talk about the treatments, the trends, and how to find a provider that you can trust. Because when it comes to your health, your face, and your results, there is a right way to do it. Hey everybody, on today's episode of the Med Spa Method, I'm going to be talking about Botox. And just as a quick disclaimer, this of course is not medical advice. I'm not your injector, so I'm not giving you advice about how to get your injections. And I'm also not your teacher, so I'm not teaching you how to do injections or dosing or whatnot. So that's my disclaimer here about this topic. But Botox is one of those things that people automatically associate you with when you have a medical spa. And it's also one of those things where you say Botox, but you might actually mean Xeomin, Jeuveau, Letybo, Daxxify, Dysport, but the word is Botox, just like Kleenex is used for tissue paper. And so for that reason, I think this episode should enlighten you a little bit to what's all out there and what's available to you and what's normal and what's not normal. So diving right into it, I did kind of mention there's a whole bunch of different products out there, and dollar for dollar or dollar for unit, I think they end up being very similarly priced. Once you break down how the units work, I think your treatments all should come out to be similar in price tag, regardless of which brand you're using for and you're going for. And instead of choosing a brand based on the price tag, you should choose the brand based on how that product works or what your injector prefers. And I know that that sounds like, you're giving them all the control, but at the same time, they're the ones who are injecting it. And if they're the most familiar with a certain product, you're probably going to get the best outcome with that certain product. So when I opened up, I used all Allergan products. And what that means is Botox, or the flagship household name Botox brand, is an Allergan product. I was trained primarily with Allergan products. And oftentimes, at least in my med spa world, we compare things to the Allergan product because that brand name is so big and so well known. So for me, I still say the word Botox, and I still compare a lot of my treatments up against Botox because of how I was trained, and because of how my clients kind of have grown with me. So in the Allergan world of Botox, that Botox brand, an FDA indicated dose just for the top of your face. So meaning nose up, we're treating the wrinkles on your forehead, the wrinkles in between your eyebrows, and the wrinkles around your eyes, or the crow's feet. Just in those three areas alone, they were FDA indicated for 64 units. And when I was trained, a common price tag was $10 a unit. So those 64 units, easy math, I liked $10 a unit because it was easy math, but was $640 before any discounts or promos. Now, prices like everything else have gone up now. And in my area, we are now charging $12 a unit, but I've seen $14, $16 a unit, which does make sense in different areas. Prices have changed a little bit, but my point is that upper face treatment at the time when I was trained was about a $640 treatment at that time. So it should be mentioned, of course, that in Botox or any neurotoxin, when we talk about the number of units that are used, there's a saying called dose equals duration. And what I mean by that is the more units you use, the longer it lasts. So when people say, oh, I just want baby Botox, what they really mean is they want their Botox not to last as long. So they might get lesser effect for sure, but it also just will not last as long. So when we don't use appropriate doses as an injector, I have to caution people. Okay, so you're asking me to put, less than half of what is necessary here. So you have to be okay with this only lasting a short amount of time and it not, maybe reaching full potential. You might not fully get your wrinkles relaxed, and then it might only last 2 months instead of 3.5, 4, something like that. So dose equals duration is a phrase that hopefully I'll remember to say a couple more times to make sense during this talk. So again, with Botox, the pricing is now at about $12 a unit in my area. And what I liked about the Botox brand, or still like about them, is they have a nice rewards program called Ally. The Ally Rewards program is short for Allergan, and it allows your providers to give you points for any treatment that you have done, not just Allergan products. So, of course, if you get Allergan products, they're going to give you more points. Those points turn into dollars that you can use at your next visit. So, it's not an immediate discount. It's like you're storing up a bank. But for Ally points for Botox brand, you would earn 200 points at each visit, which is going to turn into $20 off at your next appointment. And then, fillers the same way. You get a syringe of filler, you end up getting $20 off next time. And then they run these specials all the time where like you get an extra 100 points or an extra, and they'll even do big ones, like an extra $100 if you get these 2 treatments at the same time during special times of the year. And so I really find the Ally program to be really helpful for clients, because also whatever the provider puts into their point system, the client can now see that and keep track of that in their Ally app, so they can remember, oh, it has been this amount of time since I've had my Botox, or oh goodness, it has been a full year since I've had my lips done, or something like that. So I do like the Ally program very much. And the other reason that I really like it, as I sort of mentioned before, is that it does give you, the provider, the ability to give clients points for non-allergen products. So for example, even if they came in for a neurotoxin and they got Jeuveau, I could still give them points. Now I'm not going to give them 200 points, it's going to be 50 points. And if you remember their silly math, that turns out to be $5 off their next appointment. But what Allergan's point here is that you can only spend the points on Allergan product. So they're saying if they go ahead and give you the points on all of these other treatments, you can come back and spend that on an Allergan product and they'll still win you back. And it's successful. It does work that way. There's a provider app and a patient app. And like I said, I really like that patients get to have that on their phone. The treatment results with a Botox brand is going to start setting up in like 3 to 5 days. And then we get full results at 10 to 14 days. So I like to explain to my patients, regardless of which product we're injecting, I like to tell them you're going to start noticing results in about 4 days. And it's going to be fully on board at 14 days. And for that reason, I don't do any Botox touch-ups for the first full 2 weeks. And that's because if we're somewhere in the middle there where it's a little bit gray, like maybe 10 days, and maybe an eyebrow is a little higher than the other, and a client comes in and says, I'd like you to fix this, and I inject another 1-2 units to fix that one brow, well, it might finish setting up. So for that reason, I don't like to touch up any tox until it's been a full 14 days. And I do that just so that we don't run into an overcorrection situation. And that might sound maddening, but once you've experienced that as an injector or as a patient, it will all of a sudden make sense why we need to wait those full 14 days. Now, another aspect about Botox or any toxin that you have injected is how heavy the product is. And the heaviness doesn't really make sense until you've been treated and you can feel it yourself. But we're talking about the molecular weight of the product and how that feels when it's injected. Botox is one of the heavier products. So when it's injected, you can feel like a very firm or heavy feeling especially in your forehead. I don't think I've noticed or had anyone ever notice like that their crow's feet are particularly heavy, but I have had plenty of people talk about how heavy the product feels in their forehead, especially when it comes to things like lifting your brows to put on your mascara and more. So, with that being said, there are products that are a little bit more lightweight. And since Botox is more heavyweight, I'll often use that as an example, especially if someone has had Botox before. I can tell them definitively, oh, sure, I can put this product in, it will be more lightweight. And I think you'll like that better because you'll have more ability to raise your eyebrows and put your mascara on, or a little bit more movement and expression without making wrinkles. So now I want to talk about the lightest weight that I have ever worked with, and that would be Xeomin. Xeomin, um, it feels in the injector's hand a lot like Botox. Unit for unit, they're similar, but it's incredibly lightweight. There's no protein on the product. So it's just a pure neurotoxin. And it sets up again in about 4 to 5 days, gets going, and then it's fully on board again in the 10 to 14 days. So for the injector, when you're going from Botox to Xeomin, it's very easy for you. You can reconstitute them the same way. You can use them in the same way. It's just that your results are going to vary a little bit differently. I do find that in order to get more of that full or that Botox look out of Xeomin, you have to inject a higher number of units. However, if you were to do the same injections on the same person with Botox and then 3 months later the exact same with Xeomin, you'd still get similar results at rest. But when the patient animates, you would see more movement from the Xeomin because of its molecular weight. I also find that since it's protein free, the duration is a smidgen shorter on Xeomin, meaning even if you injected 64 units of Xeomin, this time they might only get, 2.5 to 3 months versus Botox, they might get 3.5 to 4 months. And that's, in my experience, what I have been seeing. Now, in my area, I'm kind of in a rural area where we don't have a lot of people who want to purposely look like they've been Botoxed. We have a lot of clients who like the very natural look. And so, for that reason, we're not always going all the way up to the 64 units for that upper face Botox. Instead, we're doing a little bit more conservative dosing, more like 50 units, and that's just to make the results look a little bit more natural, to preserve a bit of movement so that our clients are able to pretend like they haven't had Botox, or they don't feel like it's as noticeable to strangers. It's not that we need to lie about having Botox. I certainly do not mean, but I hope you know what I mean when you just don't want people to know that you've had something done. You just want to look like you're getting good sleep, drinking all your water, exercising, and aging gracefully. So Xeomin does have a rewards program as well, and that rewards program is called Experience Plus. And what they do is a little bit different than the Botox, which is Alley. The Xeomin Experience Plus, they let you get points off that day, or a discount you could qualify for that day. And they run specials, of course. Like one year, there was like all summer long, you got $50 off at your treatment immediately. But they also let you get points off for next time. So they will reward you with $10 off for next time. And then they'll often give you 50, sometimes 100 off that day. I've seen as well. So those promotions, I felt like as an injector, I'm not always sure what the promotion is. And sometimes it's a surprise or different per patient. So when they come in and they tell me that they like Xeomin, or even sometimes if we're just talk and shop and we just want to bargain shop and see what else is who's got the best coupon out there right now. I'll check what they have on Xeomin. I'll check what they have on their alley points, etc., and try to get them the best deal that day if that's what they want to do. So Xeomin does that, $50 or $100, and then you can also bank up those $10 each time. The caveat is that with Experience Plus, you can only get points every 90 days. And so with they're doing that on purpose, is because they want the clients to come back every 90 days and keep getting their treatments. But what that means is if you came in and got your forehead done and then budget allowed you to come back 2 months later and get your crow's feet done, you wouldn't be getting points each time. They really want you to have that all stacked together in one appointment, which in my opinion is the best way to do it anyway, so that everything looks like it's at the same stage. And it truly is easier for your injector. And I think overall you'll require less units if you do your tox all together about every 90 days or so. So that's how the Experience Plus point program works. And then there's Jeuveau. Jeuveau has won over my heart. I was so skeptical because I was pretty happy with my two options at my disposal, which were Botox and Xeomin. At that time, I was pretty happy about it. And I got a call and said, "Hey, would you like to try this product? It's called Jeuveau." And so I did. And it's just won over my heart. And this is why. It's a little bit heavier, more like Botox, but it seems to last a little bit longer because of the protein that they use on it. And when I say a little bit longer, like I'm not blowing your socks off here. I'm talking like 2 weeks. It lasts maybe 2 weeks longer than Botox. And it can be injected very similar to Botox, but it is just a smidgen more precise. So your injector has to be a little bit more skilled to place it. And when I teach our injectors how to inject it, I tell them if you can inject Jeuveau and make it look pretty, you can inject anything. So that's often our what we train on, is because once you learn Jeuveau and you can be that nitpicky with your injection sites, then they can pick up Botox, they can pick up Xeomin, they'll be just fine injecting those products. So Jeuveau, I feel like lasts maybe 2 weeks longer. And then I feel like the setup and the fully on board is about the same. So starting to work around 3 to 4 days and then fully on board at the 10 to 14 day mark. So the same policy applies. You'll start noticing results, and then you're going to have that fully on board at 10 to 14 days and no touch-ups until 14 days. The amount of units that you need is very similar, and the feel, like I said, is maybe a smidgen lighter than Botox, but is very natural feeling and able to achieve, if you want to achieve a frozen look, you can do it with Jeuveau, and you can do it with Botox, and in my opinion, you cannot do it with Xeomin. Um, Jeuveau does have a pretty cool rewards program. Again, they're going to have that 90-day rule, so you're not going to get points until it's been 90 days, but they give you immediately being able to use those points immediately. So every 90 days, you qualify for a reward, is what they're called. And in those rewards, they range from usually $40 to $80. So in this program, you don't need to have an app on your phone. You don't need to have an account with a password. You don't have anything to remember as the patient. And I love that because how many passwords do we have out there? I just would not want another password. So it's all tied to your cell phone number, and they do it in kind of a fun way. They have you set the client up with this account that's tied to their phone number, and then you send them a text, and the client reads you this silly phrase back to you, and it's something like blue butterfly or purple record or something that usually fits the season, but they give you that phrase back, and you just key in that phrase as like a code as the injector, and it gives them the points right there. So it's usually $40 to $80. Sometimes they'll make it 80 if the client hasn't been in the chair in a significant amount of time, or if there's a special or something going on, then, everyone will get $80 or something like that. And one time there was a huge promotion and it was $120 off your treatment. And that was just a wonderful bonus to be able to offer to people. So it's priced the same, and the rewards program is available every 90 days for instant savings, which I love. Now, like I said, that is kind of a caveat, because if you come in at 89 days, there's not a reward there for you, which is kind of a bummer. So what they do at the 90-day mark is they send a text because it's based on your cell phone number. They send you a text that says, "Hey, you've got your next reward available. It's time to book that Botox or Jeuveau. It's time to book your appointment." Um, and I love that for clients. I love that it reminds them that it's about time. I love that they know that they have a reward and it's not a guessing game when they come in like it is with the other programs. So that's a pretty cool rewards program. Now, another one that's pretty popular, not in our area, is called Dysport. Dysport is a product that has a little bit wider spread. So, as far as learning how to inject it, it's a little bit easier for the injector to learn how to inject because you don't have to be as precise with your injection points. Um, but Dysport is known to set up a little bit faster than some of the other products, and I have heard people say that they feel that it lasts longer. And we don't carry Dysport, so I don't have the most experience with how is this product finicky or anything. I don't know because we're not carrying it in my medical spa, but it is loved by some injectors and by some patients. It's made by Galderma, and they do have a rewards program, but like I said, I can't speak to it. But Dysport is out there, and as far as I understand, it's not quite as heavy as Botox, and it can of course achieve similar results. The units are a little bit different, and so some people will talk about Dysport in quotations. I'm saying Botox units. They'll talk about it that way, or they'll just give you the Dysport pricing, and you have to kind of math it out. Your full treatment would still be probably about $600 to be done with Dysport, just like it would be with Botox. So, um, unit dollar for unit, it might show up differently, but you would have to know as the consumer, like, is that a Dysport unit or is that a Botox unit that you're pricing that at? Because it makes a difference when you math it all out. The next one that I would talk about is called Daxxify, or people will call it Daxi. Daxi came out, and that's made by Revance. And Daxi came out, and they initially said this is a 6 month neurotoxin, and people are very excited about it. And then once it started getting out there a little bit more, and it was of course priced a little bit higher for that. Uh, Once people got their hands on it, they noticed, oh, it's really not 6 months. It really might be more like 5 months. And if it's underdosed, remember dose equals duration. If Daxxify is underdosed, it really only lasts just like Botox does, which would be in about 3.5 months, maybe 4 if you have a heavy dose. So in that regard, Daxxify is actually kind of similar to Botox in duration. What's cool about Daxxify is it does start working a little bit faster, more like 1 or 2 days, and you can already start seeing results. Full results are still going to be 10 to 14 days, but you can start seeing the results even sooner. And what's also cool about Daxxify is it has a peptide in the product that actually makes your skin glow. So now you're getting even more bang for your buck because the product is giving you smooth skin with a glow, which is pretty cool. So, again, you have to ask how the units are being dosed because to get that 5 month longevity, you're going to need twice what you would need, probably similar to twice, is some easy math of what you're going to need to get to that longer duration. So, if you were planning to come in to get 50 units, and you want that longer duration, you're gonna need 100 units. The benefit there, of course, is that those 100 units would set up a little bit faster, and you would get a little bit of a skin glow from it, which is pretty cool. As far as molecular weight goes, it's not as heavy as Botox. It's gonna be right smack in the middle between, like, the heaviest is Botox and the lightest is Xeomin. So it's gonna be right smack in the middle there. And then lastly, I wanna talk about sorry, Daxxify does not have a rewards program at this time. I've heard talks of one, popping up, but It's at this time, there's not one. And the last one I want to talk about is called Letybo. Letybo is the newest in the US market, and it is actually been used over in Korea for quite some time. So Letybo, when it came out, I did test it out, and for me, it behaved in my hands a lot like Jeuveau. It's a little bit precise to place it, so if I injected it exactly like Jeuveau, the results were beautiful. But the problem was it was incredibly finicky. I got some clients started you do start noticing results right away, so 1 or 2 days, you're noticing results right away. Full effect is said to be about 7 days, but it wears off incredibly fast. So I had some clients get 3 months out of it, but most of my clients were getting about 6 weeks out of the treatment. So, we had it priced really low. We had it priced at $8 a unit just to test it out and get feedback from clients that we trusted. And so for that reason, they were okay. They were like, "Oh, okay, so I only got 6 weeks, but I did get an incredible price of it. It was kind of fun to try something new, so that's okay." But I would have been upset if I would have brought the product into the spa and charged people full price for their appointment, and then they only got 6 weeks. I think they would have been upset, and then that would have made me upset. So, it was a fun trial, and when the product ran out, and a few of those clients came back and said, "Hey, could I have that one again?" And I was like, "No, we decided not to carry it." They were like, "Oh, that's fine," because they didn't love it all that much anyways. There's no rewards program with it, and the only way that I could see keeping the product around would be if somebody forgot to plan and they said, "Hey, today is Friday, and I wanna go to a wedding tomorrow night, and I'd like my tox to be starting to work at least," like, going. Be like, "Oh, okay, well, then I'll use this," or, like, it's Wednesday and the wedding's on Saturday would be a better scenario, but that would be ideal, and then I'd have to charge less for it, and what I feared would happen is I would bring the product on, and then I would use it, I would have it priced a little bit lower, and then people's wallet would make them wanna go to that product. Then then they wouldn't get the results that they wanted or the duration that they wanted, and then it would come back and kinda bite me in the butt, and they wouldn't be appreciative anymore. They would be upset that their product wasted wore off so fast, it would feel like money wasted. So, for that reason, we didn't go on with Letybo. I know there are some practices out there that are loving it and marketing it a little bit differently, so keep that in mind if that is something that you wanna go give a try to. So let's talk for a minute about we've talked about all the product options for you. Let's talk about the treatment areas. The most common areas, as I talked about earlier, of treatment areas are going to be the forehead, in between the eyebrows, and around the eyes. That's been coined the look of three by the Botox brand once again. But there's actually so much more that we can use Botox for. If you scrunch up your nose and see those cute little lines there, those are called bunny lines. And we can slow those down a little bit. We can make the upper lip look a little bit more plump by injecting a tiny bit above the upper lip. If you have a big smile and it shows the top of your gums, we can drop your smile down a little bit, and that's called a gummy smile. If you are starting to feel those marionette lines or like lines near your jowls, like your lips are turning down, we can slow the pull down on that muscle so that your lip doesn't pull down quite as far. It's not going to make your marionette lines go completely away. It's not filler, but it does help a little bit. So that's a cool injection site as well. Some people have like kind of a dimply chin, or people will call it a cobblestone chin. And a little bit of Botox in there will quiet that muscle and smooth out your chin. It even elongates your chin a little bit, which is nice and feminine. We can also use Botox along the jawline. And what that's doing along the jawline is it's relaxing the muscle of your neck, which is pulling on your jawline. And by relaxing that muscle, it's going to make your jawline look like it's more carved out or snatched, if you will. So that's a cool treatment as well. On the neck, there's these little bands that can kind of pull on your neck and make your neck look older. We can also quiet down those bands on the neck. And then we can also treat with Botox, we can also treat the masseter muscle, which is sometimes done by dentist office for people with TMJ or that grind their teeth or that get migraines. So treating the masseter muscle, it's a big muscle right at the back at the corner of your jaw. And it's a muscle that's used heavily for chewing, grinding the teeth. And when you grind or um, when you clench a lot, that muscle can get bigger and it can make your face square out a little bit. So by putting Tox in there, you can slim your jawline a little bit, and it does relieve TMJ, migraines, etc. It's helpful in those situations. Um, and then I suppose I should also talk about the migraine protocol, which would be um, placing Tox in various areas around your head for migraines. The true migraine protocol is once again coined by Allergan. They got the FDA approval for it. It's over 100 units in total, in which they do your forehead and between your brows, but not your crow's feet. And then they also place Tox in the trapezius muscle, which is like the top of your shoulder to help with tension, some Tox at the back of your head to help with tension, the temporalis muscle, which is kind of right above your ear and your hairline to help with tension as well. So, in combining all those areas, that would be a Botox for migraine protocol. Now, there are some other areas that Botox can be used for therapeutic purposes, and most of the time, you're not going to find a med spa injector that's also doing that for like muscle spasticity. And then in the hospital world, we do use it for in the bladder injections as well, stuff like that for medical purposes. But again, you're not going to find that in medical spas. As far as common complications would go, most of the time, all you're going to experience is maybe a little bit of bruising where you were poked with a needle. And then in more rare situations, you could have maybe a dropped eyelid or a dropped eyebrow, and that's based on injection technique and post care. And then you could, in rare situations, you could experience a reaction to the product. But I've never seen that happen. I've never seen someone have a reaction to the product. I've seen a few heavy brows happen, but knock on wood, we've not had any lids dropped in my practice. And I feel like most of that's going to be injection technique, but it can be some post care as well. So, as far as post care goes, we recommend that you don't exercise or do anything that causes sweating, like drinking alcohol, sitting in a hot tub or sauna for 24 hours, because we don't want that increased blood flow to move around where the toxins went. I also don't want you to get any aggressive facials, wash your own face aggressive, or even things like dermaplaning can just push on your tissues and move where the product is around, especially in those first 24 hours. Truthfully, we tell people, can you stay away from those facials and whatnot for a full 2 weeks while we're just letting the product set up. Anyways, advise people to use Tylenol or ice if it's uncomfortable, and to stay away from things that could cause more bruising, like ibuprofen, fish oil, a whole bunch of garlic, and etc. So that's most of my Botox talk. And I hope that hearing about all of the products and understanding how they work is helpful. If you have questions about your Botox appointment or areas that you'd like to treat, and is this a Botox area or a filler area, I'd love to hear from you. So go ahead and drop those below. It was so nice chatting with you.